students, welcome to Visu Online. Today the topic is Selection of Principal Diagnosis for Vaginal Delivery. ICD 10cm PCS Coding Clinic first quarter ICD 10 2026 page number 3. Okay, we are going to start. When an obstetric patient is admitted, the condition that prompted the admission should be sequenced as the principal diagnosis. A code for any complication of the delivery should be assigned as an additional diagnosis. For example, if a patient is admitted for treatment of preeclampsia and fetal deceleration, complicate spontaneous vaginal delivery, the preeclampsia should be sequenced as the principal diagnosis and rather than fetal decelerations. If there is no pregnancy complication of prompting the admission, then delivery complication code should be assigned as a principal diagnosis. Here, the following questions and answers have been developed for the further clarification. First one, induction of labor due to gestational hypertension. Here go with. Yes, the question is, the patient is admitted for induction of labor due to gestational hypertension and experiences a third-degree laceration and a nuchal cord entanglement during delivery. What is the principal diagnosis? Here go with the answer. Assign code for delivery complicated by gestational hypertension as the principal diagnosis. Assign a code for the third-degree laceration and nuchal cord entanglement as a additional diagnosis. Okay. The next question: periurethral laceration during the delivery. Question: the patient had no complication during the pregnancy and is admitted in labor. She delivers a healthy, live-born infant. However, the patient experiences a periurethral laceration during delivery that is repaired. What is the principal diagnosis? Answer: assign a code for a delivery complicated by periurethral tear as a principal diagnosis. In this case, the patient was admitted without any complications of pregnancy. However, the patient suffers a tear during the delivery. The main circumstance or complication of the delivery is, in this case, is the periurethral tear. Next one: pregnancy complicated by gallstones and anemia. Pregnancy complicated by gallstones and anemia. Question: the patient is admitted in labor. She has gallstones and anemia or admission, and the physician has not documented that these conditions did not affect the pregnancy. She delivers vaginally but develops atony with hemorrhage after delivery. What is the principal diagnosis? Delivery complicated by gallstones, anemia, or uterine atony with hemorrhage. Answer: since both conditions were present on admission, assign a code for pregnancy complicated by either gallstone or anemia as the principal diagnosis. Assign a code for uterine atony with hemorrhage as an additional diagnosis. Why? Codes from chapter 15 always take a precedence, and it is the provider responsibility to state that the condition being treated is not affecting pregnancy. That's why we are giving anemia or gallstone as a PdX. Pregnancy complicated by gestational diabetes or postpartum status. A 41-week pregnant patient was admitted in labor. Her pregnancy is complicated by gestational diabetes mellitus and postpartum status. The patient delivers and suffers a second-degree perineal laceration, which is repaired. What is the principal diagnosis? Assign a code for either delivery complicated by gestational diabetes or postpartum pregnancy as the principal diagnosis. When a patient is admitted for delivery, the condition that prompted the admission should be reported as a principal diagnosis, and the code for the second-degree perineal laceration and additional diagnosis. Because here, the patient is coming with the reason for admission will be complicated by gestational diabetes and postpartum pregnancy only. Okay, after the admission only is developed second-degree perineal laceration as a secondary diagnosis. We cannot code it as secondary degree perineal laceration for the principal diagnosis. Okay, if the patient is coming with the second-degree perineal laceration and the patient is done for the repair is, and that case is only we have to code second-degree perineal laceration as a PdX. Okay. Pregnancy complicated by polyhydramnios. What is polyhydramnios? Accumulation of fluid in amniotic sac, which is called polyhydramnios. A 39-year-old pregnant patient is admitted for induction secondary to polyhydramnios and delivery vaginally. During delivery, she suffers a secondary degree tear, which is repaired. Is the principal diagnosis for this admission pregnancy complicated by polyhydramnios or laceration that occurred during the delivery? Answer. Assign a core pregnancy complicated by polyhydramnios as the principal diagnosis. The patient was admitted to the hospital for induction due to polyhydramnios. Therefore, this condition should be assigned as a principal diagnosis. Assign a code for laceration as an additional diagnosis. Next one. PROM, premature rupture of membranes. Question. A patient is admitted to the hospital for delivery following premature rupture of membrane. During the delivery, the patient suffers a laceration, first, second, or third degree. Is the principal diagnosis for this admission pregnancy complicated by premature rupture of membrane or the laceration that occurred during the delivery? Answer. Assign a code pregnancy complicated by premature rupture of membrane as the principal diagnosis. When a patient is admitted for delivery, the condition that prompted the admission should be reported as a principal diagnosis. A code for the laceration should be as a secondary diagnosis. Okay, delivery with SRYM greater than 24 hours, nuchal cord and third degree laceration is available. A patient admitted with the spontaneous rupture of membrane greater than 24 hours. The patient failed to progress in a labor with arrested dilation. Pitocin augmentation was administered. She progressed to complete dilation and delivered a live born female. Deliver a live born female with a loose nuchal cord. The patient also had first degree vaginal laceration, which was repaired. What is the principal diagnosis? Answer. Assign a code pregnancy complicated by premature rupture of membrane with onset of labor after 24 hours as a principal diagnosis. Assign a code for the first degree vaginal laceration and nuchal cord as an additional diagnosis. See, when the reason for admission is a PROM after 24 hours. Okay, so if the patient admit with the SROM after 24 hours, there is no induction of labor, then we need to consider it as a premature rupture of membrane. Okay, the coding says we have to code pregnancy complicated by PROM as with the onset of labor after 24 hours as a principal diagnosis. Assign a code for the first degree laceration and nuchal cord is the secondary diagnosis. This is a selection of principal diagnosis for the vaginal delivery, guys. Okay. Next time we'll discuss about the pregnancy complication. Thank you for watching this online training. Thank you all.